Yeah, well, so you made me watch a 20-minute video from Squat University about, was it 7 key things to
Seven
keep in
steps.
mind for 7 steps for fixing your low back pain. It's a brand new release from Squat University. Yeah, so we're going to talk about that today.
Yeah, I forced you to watch it. I taped your eyes open, sat you down, said you're watching this. For people who don't know, I had to do a little background check on him, but because in his bio he just says like Doctor so and so, and turns out he is a doctor of physical therapy, so he does have a physical therapy background, and he's got a pretty, I would say, a pretty good following on social media. I mean, he put up his low back pain video on YouTube, and within an hour it had several thousand views. So he has a lot of people that respect him, and we both think that he does put out some good content when it comes around different things like back pain, lifting, some shoulder stuff. Like, we're not trying to come off as a bunch of jerks on this podcast. In that we do think that there's some good things that he puts out. Now, with that being said, this YouTube video on 7 steps to fix low back pain, I originally felt that, okay, there's some things that he's talking about here that I don't wholeheartedly believe with. And I think I can predict your thoughts sometimes, Christian. I'm like, I don't think Christian would maybe wholeheartedly believe with this stuff. So I sent you that video, and I was like, dude, I think let's do a podcast on kind of breaking down, reacting to this 7 steps on how to fix low back pain from Squat University Guy, and speak on what we believe to be true from the research that we read and the people that we listen to, and just kind of have a discussion around some different points. And hopefully, I think it would be doing our studying, because that's what it is, right? Christian and I, we both, even though we're out of school, we're still studying a lot when it comes to reading research or listening to researchers or clinicians on podcasts, etc. If we just sat back and didn't say what we believe to be true, and then we'd be doing our own self and our own studying efforts a disservice by not putting what we believe to be true out there. So this is a little bit of just kind of like, all right, we see what he's saying, and this is what we believe to be true, and let's just discuss kind of the in-between. So that's where we're coming from. My apologies if I sound like a dick halfway through. I'm not trying to be. And maybe I could say that for Christian as well. But once we get going on these topics, sometimes there's no bringing us back. So that's just a little background on what the podcast is on today, and a little quick disclaimer before we jump into it. So I just want to start off, Christian, by saying this. I would absolutely love to take every 7 steps from this video and apply it to every single person that I see with chronic low back pain and acute low back pain, and just take a percentage of how many people will get better. To me, it makes me a little frustrated when we make a video on social media or YouTube from PTs, chiropractors, fitness individuals, and we broadcast it like it's going to fix every low back pain, everything, every time, because it's the perfect recipe. I think no doubt some of the stuff we're going to get into can help people, but I think this one size fits all, do these 7 steps and you're going to be fixed, I think that's a really far reach. But I would say that's my opening statement. I would love to take these 7 steps, implement them to every single person, my 20-year-old, my 78-year-old, my 90-year-old with low back pain, and be like, hey, this guy said it's supposed to fix it, so go do it, and then you're welcome. You should be fixed.
Yeah, I agree with everything that you said. I also don't want to come off as being mean. We're just both very passionate about this stuff. We want to make sure that we are not feeding into myths and misconceptions and not painting a picture that this is how you get better. It's just not true. So
Yep.
overall, I highly respect him. I respect the content that he makes. I think he's helped probably thousands of people, far more than we have, with his broad social media presence, and that's a really good thing. But when it comes to this video, there are a couple things I do think are important to highlight. When watching this, I can't help but think he either is intentionally lying to people about the effectiveness of this thing in order to promote his style of therapy and sell some products that he sells. As you can see, all the, was it TYR or TYR, whatever the hell that is? All that branding stuff is all over the video.
Yeah.
Yeah.
I think is like friggin' line of lifting shoes.
So he's either lying to people or he literally hasn't read a single study since 2017. And if he has read studies since 2017, he's completely ignoring the insurmountable amount of evidence that is contrary to his stance. And I think that's quite dangerous. As he posts a lot of different clips of studies, like he just like slaps the picture of the study on the screen. Yeah, sure, like those are biomechanical studies that say a thing that supports what you say, but that's just a snapshot. Like there's a lot of other stuff out there, and when you pick your favorite things and you want to talk about that, you're going to paint the wrong picture. You got to take all the stuff that's out there in aggregate and form a more comprehensive and coherent argument. My main takeaway from this video was that it serves as an excellent time capsule. Time capsule for how I viewed the world of physical therapy and low back pain rehab in 2016 and 2017 when I first started practicing. Because I graduated in 16. And that everything that he says in this video is what I did then, verbatim. Yeah. But then I kept learning and I kept growing, and you realize at some point that when you do these things, you don't get everyone better. It just doesn't work. You have to evolve. You have to take in new information and keep trying to get better. And a lot of what he says comes out of a book that was published in 2015 from Dr. Stuart McGill, his main biomechanist source that he cites in the video. The book is called Back Mechanic. I read that book cover to cover, and I used a lot of the principles early in my rehab, but I still do some. There's still some good stuff from there. And that work, that Back Mechanic book from Stuart McGill, and everything that Squat University is saying right now, it's a natural progression of the core stabilization camp that came out, I don't know when, 70s, 80s, 90s, and it perpetuates throughout now. And I still think it's the predominant way of viewing low back pain, and that's just something that needs to change, and we're here to talk about that.
Yeah. I think I got very lucky in the fact that I had you as a clinical instructor post 2017. And then I've been getting brought up in my little infantry of professional practice with people like Greg Lehman, Peter O'Sullivan, like E3 Rehab. You know, the list goes on. It's I got very lucky coming out of PT school and being led in the right direction, I believe, when it comes to this stuff. And so, although I'm not as well adversed, like you mentioned, Christian, like reading the books and the Back Mechanic, and then also just kind of like living this way of practice for give or take 2 years. Like I think that's good stuff to highlight kind of our backgrounds on where both of us come from on this viewpoint. One of the things that I wanted to dive into right away, and this was early on in the video, one of the things that I immediately was just like, all right, we gotta talk about this. Discussing this idea of like wear and tear on the discs with different style of movements. I think he has like a video of like a lady vacuuming or picking stuff up off the floor, and she's very clearly utilizing more lumbar movement than anything else. And he goes in to discuss how comparing a disc in the lumbar spine to a t-shirt, and how when you rub the t-shirt together, it frays and then rips. And then basically said, hey, this is a great analogy of what happens in the disc when you do these terrible, obscene movements to the low back, and then over time, your discs are going to tear and rip apart. Yeah, like bullshit. Call BS on that. One, I don't know if people know this, but the disc and vertebrae in your low back are living tissues. They aren't a frickin' t-shirt that have no ability to adapt to different stress. So I think that's the big one. I think we're really doing our anatomy and our biology a huge disservice when we compare it to objects that aren't living. So I personally think, this is my take on it. One, I would agree to the fact that if you're picking stuff up off the floor, and if you're doing what's called like a stooped posture, so you're bending over to pick it up more with your low back than anything else, and that hurts, we should maybe stop doing that for just a little bit to activity modify. That's one of the things that he talks about in the video quite a bit, is changing activities or doing stuff differently. Yeah, that's just a fancy way of saying we're going to modify our activities so that we can calm shit down to build it back up. And if you look at CPG information for any type of ailment, low back pain, knee pain, shoulder pain, etc., like some of the best evidence to treat stuff with is just activity modification. I would agree. If you have pain with a stoop posture, let's modify the activity, but it doesn't mean that the back and the vertebrae and the disc, etc., that they're not A, living tissues that can adapt. Doesn't mean that B, they're weak and they're going to break and they're fragile. And lastly, C, it doesn't mean that if we load it in the correct pattern over time, that we can't build up the strength so that, yeah, you can do stuff with astute posture and you're going to be just fine because we trained you and we trained your body, or you trained your body in that manner to be able to tolerate that type of stress.
Yeah, you bring up a lot of different thoughts. I think the first one that I want to be very clear about is in the video, early on, he talks about how your spine was designed. Oh, it's all these different movable segments. It's like a flexible rod, all that different stuff. And he says that it is safest and it's best and it's most effective and efficient when it's in a neutral position, meaning not too stooped or not too extended. It's somewhere in between in neutral. The first thing I want to say is that designed is not a thing unless you're a creationist. And I don't know about you, Eric, but like, I don't care if you're religious or not. I'm not a creationist. I believe in evolution, and the spine evolved over time to look like that.
And some guy with an iPad that drew that stuff up on a program and then
right
3D printed it.
Look, the spine that we have worked well enough for us to pass on our genes. And just because it got passed on does not mean that it was the best structure to have ever evolved over time. For all we know, there was a proto-human with discs twice as thick as normal that was an absolute badass, just like killing tribe after tribe. Who knows what they were doing? Slaying. Yeah. And that would have changed the course of human evolution forever. But they died of malaria or some other disease before they could reproduce. And those like twice thick discs were just lost for the rest of time. That's how evolution works. Yeah, so like, and I guess the second thing I want to say is that biomechanical studies, which is a lot of what he cites here, are cool, but they're theory. It's a bunch of dudes in a lab using cadaver spines and applying a lot of different stress to them and seeing what happens. And of course, going to your point, Eric, if you stress a dead structure over and over again, it's going to break down. But if you appropriately stress a structure over time that's living in a real human body, it will adapt to that stress. And that brings me to a very important theory that I think we need to be clear about here. And it's a theory called the physical stress theory, or as everyone knows it, use it or lose it. This theory implies that people's fitness is in a constant state of change in response to the stresses that you impose upon your body. You're either atrophying, maintaining, or gaining. Your body has evolved to conserve resources at all costs so you can survive. So it doesn't want to adapt and put resources towards building structures to be more strong if it doesn't have to. So if you stop stressing your body, it weakens. If you do the same things all the time, it maintains. If you challenge your body, it gets stronger. So that's a very important thing to keep in mind, that your spine is not some inert structure that you have to protect for the rest of your life. It's a thing that you need to train and use, and over time, it will keep adapting.
Yeah, absolutely. Also in the video, he talks about how your vertebrae, if you have like a weak core and it's not stabilizing, that it can, kind of slip back and forth, right? I think it really paints this picture to people that don't know anything about it. The lay person, oh my gosh, I have a perfect example of this. I have a patient right now who is 50 years old. And she was told by a neurosurgeon that her back was basically weak and fragile. She was told by a chiropractor that her back is so messed up and it's on the verge of breaking. And to the point to where now she's 50 years old. She walks with a cane, shuffles her feet, doesn't want to do anything, believes that if she does any type of lumbar movement, her back is going to snap and she's going to be, lose all of her independence, etc. What my point is that this type of messaging of like your vertebrae are moving, and like if you don't have a strong core, or if you keep moving in the wrong direction, like that's going to get worse and that's going to break, it's going to cause pain, etc. To me, that's just, for like a lack of better term, and I hope I'm not using this inappropriately, but like that's just like fear mongering to me. Like that's what it is. It's saying like, hey, if you're doing this is what's going to happen to your back, and it's like eliciting fear into people, so they go, oh shit, I better start doing whatever you're saying then, when like that's just not true. And so now with this patient of mine, we've had 3 sessions. Everyone has just been basically me handing her tissues after tissues because I'm just giving her room to just let it all out before we actually start doing stuff. But it's just been like three 3 45-minute sessions of just trying to educate her and talk her out of this belief that her back is this weak, fragile thing and that she's never going to be able to live her life again. I wanted to bring that up as well because I think it's super important. When we say that we're doctors of physical therapy and we start telling you all these crazy things about your back and how it's super weak and it's going to break, people believe that. And that can lead people down not very good roads because they don't have any guidance on what you're actually saying. Anyways, moving on, I wanted to speak real quick about some like examination techniques that he talked about as well in the video to like figure out, well, he mentions he's basically doing a directional preference screen of the lumbar spine, you know, flexion intolerance, extension intolerance, etc., and what those different things can mean. And then he also goes into this idea about how if you go up onto your toes and then you drop on your heels, if that pressure makes it worse, and then if you press in your obliques and somehow that activates your core and that makes it better. And then, you know, he discusses how spinal instability or like end plate, like vertebral end plate injuries, whatever the hell that means. So anyways, my take on this is I don't want to get real specific on it, but I do think that sometimes as clinicians, we can overestimate how well we can, I guess, diagnose and know the body. I don't think it's a bad idea to speculate on things. I tell patients that all the time. I say, I think based off of these things, this is probably what's going on. But I don't really give like a definite answer. And the reason for that is I'm more concerned about, do you have pain with this? And if we do this, does that make the pain better? And over X amount of weeks, does your pain go away? And are you back to doing what you want to do? You are? Great. And I don't give a bleep about what structure it was or why you were getting it or what biomechanical flaw you were getting it from. Because if we can do things in rehab to make your pain better and then you're getting back to what you want to do, that's the most important thing. And that's what people care about anyways, right? And so I want to just talk about quick, I guess, this idea of diagnosing specific tissues and how sometimes I think that as clinicians, we get overzealous of how well we like know the body and how these different algorithms and signs and symptoms like point us down these different paths. And it's like, you know, there's sensitivity and specificity for a reason, right? It's to tell us if what we're doing is actually what we think we're doing. And there's a lot of stuff, there's a lot of tests in the orthopedic world that don't have the best sensitivity and specificity for things. And so, I don't know, I'm a little leery on that aspect of it as well. I don't think it's a bad idea to look at functional movement and be like, oh, you have pain with these things, but to take it a step further and to be like, oh, if you press on your obliques and it's better, you have spinal instability. I feel like that's a pretty big jump to go from A all the way to Z.
I don't even know where to start with that.
Sorry, I'm just going on these rants right now, and then it gets blown up into a 5-minute thing. But anyway, sorry.
Yeah, so I think where I will start with that is it brings us to an article that I think we discussed some podcasts ago called The Myth of Core Stability, which is an article from 2009 that brought to light many of the myths and misconceptions around core stabilization exercises, the idea of core stability in general, whether you have an unstable spine, whether your spine can adapt or not. All this stuff is not new. This is old as hell, older than us. And the bottom line is this. We've studied how people contract their abs when they move. If you take two groups of people, one group has low back pain, the other one doesn't. The people with pain have the least amount of movement at their spines, meaning the ones in pain are the ones that are the most stable. Their body hurts, and so their body is trying to add stability around the area so you don't move it as much, because moving it seems to trigger a pain response. And so why is it that the people that have the most stability have pain? You'd be expecting the opposite if this was your premise. And so this is just one example of all the things that are wrong with this premise. And two other things I think are important to ask is, does bracing your abs reduce your risk of low back pain from happening for the first time or happening again? And does bracing your ab get you out of low back pain better than other treatments? Because the answer is yes. Doing core type work, which again, we're saying in the very beginning of this podcast that some of these things are useful for people. I do prescribe core stability training for people every now and again as part of a comprehensive plan, because it's just one facet. So it does work a little bit, but does it work better than anything else in isolation? And the answer is no. We have very clear evidence that says things like just doing yoga or just doing Pilates, or just doing a walking program, or just doing core stability, all has the same rough effectiveness for people. And then even general exercise, even if you don't do any of that stuff and you just start doing some powerlifting type stuff or strength and conditioning type exercises, you can still get better to the same degree. And so that makes someone with a reasonable mind, not a smooth brain, ask, do all these things work? Because maybe there's a common theme with them. And the answer is yes. It's because you're exercising, you're moving, you're doing something, and there's some magic to that. And the whole thing that we as therapists need to do is figure out, what does your body like? What are your goals? How do we go from what your body likes right now to reaching your goals? What does that movement progression look like over time in terms of exercise selection, exercise style, the dosage, meaning the frequency, the volume, the load, all these different things we think about for how to get you from A to B. And core stability training is just one small part. It is not the end all be all.
Yeah, absolutely. And I would totally agree with that. I think that plays into kind of the whole premise of the video, talking about like the McGill Big Three, right? And so just basically going through an exercise progression of core stability stuff. To be honest with you, I don't even think you need to do like the McGill Big Three. Also, question, did he patent those exercises? Like, is that like, are those like his exercises? Do we have to call those the McGill Big Three? Or are we going to get fined or like sued if we just say that they did bird dogs and side planks? Or do we have to call them the McGill Big Three? Like, what's up with that?
I don't know. I think he just popularized them, put them in a cluster, put his name on them, and now they're huge. And yeah, going off of the McGill Big Three, for those that don't know, if you haven't watched the video yet, it's a curl up, which is basically like a mini sit-up, a bird dog, and a side plank. And if you do those three things, Dr. McGill has researched, and I'm not saying that he hasn't figured this out, I'm sure it's true, that they seem to put the least amount of stress on your spine while still recruiting the muscles around the spine. And so they're a nice way to ease your back into some general movement. But that's cool. Does it matter? Do you have to do these to get better? And the answer is no. I have personally helped hundreds of people improve their low back pain without giving them any of these exercises. I have also helped and failed to help hundreds of people by giving them the McGill Big Three. And not just me. This is every physical therapist out there for the last 30 years. We've all been doing this. And you know what? Low back pain is only becoming a bigger problem. We're not getting better at it. We've been doing this stuff forever. We need to evolve. We need to get away from this stuff to figure out how to be better. That's all that matters, is how do we get the best outcome. Talking about theory is fun. It's cool. I love nerding out about that. But at the end of the day, what matters is what works, what gets people better. And not just gets better, but gets them better the most reliably, the fastest, and helps the largest amount of people. You want to make sure you're covering all of those things the best you possibly can.
No, I totally agree. To that extent as well, like, I feel like sometimes we do a lot of anecdotal evidence when it comes to like stuff online about like, this is what I do and it helps people. So since we're sticking on that train, I just want to throw in there that I've given people with low back pain upper extremity training programs and they've gotten better. It shows that like you could just do so many different things, and there's other core stabilization exercises out there that you can do, or whatever the heck you want to call it, that isn't the McGill Big Three. Or if you just want to do a side plank, do a mother effing side plank. Don't worry about what it's from or what the theory is behind it. If it makes you feel better, do it. I agree with you. That's my take on that. I guess our take on that. And the other thing too that I wanted to bring up, Christian, because you pointed me in this direction a week ago about an E3 rehab video with Greg Lehman talking about strength, and does increasing strength necessarily relate to reducing pain? And are those things connected? Are we placing an overemphasis on strength when it comes to getting people out of pain? And that was a really great podcast and kind of opened my eyes a little bit more of like, yeah, they're making some good points here. Take that into consideration. And so I wanted to just bring up a lot of this low back pain video comes from the fact that like things are quote weak or not activating, however you want to put it. And you even mentioned earlier about that study on core stability and how more people with back pain or worsening back pain is actually they're too stiff, they're too braced, right? And so, like, I also just want to get your take on this. Do we think we're placing the wrong emphasis when it comes on low back pain and treatment by thinking that your low back pain is there because you're weak or you're not activating or whatever word you want to place on it? Maybe we're looking at the wrong stuff when it comes to this whole core strengthening, core stability, etc. Maybe it's not all about just getting people stronger. Maybe there's something deeper, something different in that that'll help people out.
Yeah, absolutely. And this is not just for low back pain. This is all across the body. We have evidence for shoulder, for the Achilles, for the knee, that if you have pain in those areas and you follow a group of people who do strength exercises, you measure their strength before, then you measure it after some number of weeks or months. Did they get measurably stronger? No, they didn't in some of these things. But do they feel better? Yeah, their pain went down. They can do more stuff throughout their day. They feel like they're getting better. And so you do not have to get stronger to feel better for a lot of these conditions. Is it a safe bet, especially when you consider the physical stress theory and just generally like thinking about things? The stronger you are, more likely that you can handle a bit more work throughout your day. So chances are it's going to work in your favor. Yeah, I would absolutely say that. If I can't point to studies that support that, I will still say this is my opinion. It's a belief of mine that being stronger is better generally. Totally fine. But I can't say as a licensed physical therapist who helps people that you need to get stronger to get better, because I've seen it happen when you don't get stronger and you get better. It's the research says it. It's I'm not making this up. So
yeah,
that's one thing. And then so like people can ask, are you being pedantic? Are you being a dick by saying that physical therapists or chiros or doctors shouldn't be saying, oh yeah, you got to get stronger or else you're going to hurt, and that's your problem, is you're too weak? No, I'm not being pedantic. I'm not being a dick by saying we should get away from that stuff, because what a lot of clinicians don't recognize is that words matter. The things that you say to people really matter and can stick with them for the rest of their life. Sure, some people you can say something and they don't really care. They don't take it in the wrong way, but other people, and when you say things that people latch onto that aren't constructive, that can be negatively affecting their life for the rest of their life. And one example of that, I had a patient a lot of years ago. This was, I think, actually when I just was getting away from this type of stuff and trying to incorporate more thoughts into my practice. I was seeing this patient for low back. She was a patient of mine about a year before that, for her shoulder, I think it was, and we had good rapport. We were cool. And so I was helping her with her low back pain at our eval. And she was like, yeah, I have a lot of pain, and I kind of worry about squatting and just like bending over and stuff. I was like, okay, well, let's just go out to the gym floor. Let's just look at you squat. And so I get her next to a box, and I say, show me your squat. And she looks at me. She's just like, what do you mean? I was like, I just want you to sit down to the box and stand up, just squat. She's like, yeah, but like, what should I think about? Do I need to like tighten my abs? Like, am I sitting my butt back? Am I bending at my waist? Like, what do I do? And she cut herself off when she's articulating all these thoughts, and she just starts tearing up. Swear to God, she starts tearing up in the middle of the gym, and I'm just like, whoa. Okay.
I'm going full therapist mode now.
I was like, what's going on? And she was like, well, when I went to PT for my back before years ago, they had me doing all these different things, and I just want to make sure I'm doing it right so I don't have pain. And I'm like, for right now, please put all of that aside. I just want you to focus on sitting down to this box and then standing up just like you would any chair or the toilet. Just do that. And I said that, and I got away with it because I knew her already. I might not have done that if it was someone that was new, but I said that. She did it. She stood up, and she was like, I didn't have pain. And she had a smile on her face, and it was freaking great. And I was like, good. So now that's our starting point. I just want you to focus on doing these movements that feel good. Don't have too much stuff in your head about what you learned in the past. We'll cross those bridges later. And so the point I'm making with this is that years before I saw this patient, she heard a lot of stuff, and that got into her head, and she felt like if she didn't do things correctly, she was going to hurt and she was going to do damage. And that's just not true. And so for years, she's been trying to move in certain ways to reduce her pain. And guess what? It wasn't working. So you're making people do these things. They're putting this blame on themselves. They're blaming themselves for their pain because they think they're not strong enough in their core. They're not moving properly. And if only they were stronger and moved properly and were less of a scumbag and spent more time exercising, that they wouldn't have pain. And that's not true. And I think that's something that we need to be paying attention to as clinicians, and all patients should know that.
Absolutely. And just going off of that, If you don't have the right shoes, if you don't use the right hex bar or barbell, if you don't use the right pre-workout creatine mix, if you don't do any of that stuff, and then yeah, you're a piece of shit, and you should just not ever try and work out again. That's my take on it. Clearly, I'm joking around. Yeah. So, anyways, yeah, no, I totally agree, and like, I don't think, like, again, going back to your idea about how, like, 2 million years ago, if that's even the right time frame, like, we had some badass running this planet who never got back pain in their life, and that damn mosquito killed them off, and that's why we don't have their genes now. Like, I don't think that we were, quote, designed to move in a specific pattern that's so incredibly rigid and boxed in. I feel like, just going off your patient example there, Christian, like, clearly this lady was told that, damn it, there's a specific way to move, and if you don't move like this, you're going to mess things up and you're going to have pain. And I think when I see patients, like, they get surprised. I'll have them do like a squat or like a lunge or something, and they like look at me like nervous, like, oh, what is my PT going to correct me on? And I'm like, yeah, looks good, did the movement, no pain, let's move on. So yeah, and then I'll sometimes, if I can tell they really want more, I'll be like, yeah, you could tell that there's maybe a little bit of this going on, a little bit of that going on, blah, blah, blah. But at the end of it, I just go, honestly, it probably doesn't matter. Just keep doing what you're doing. You don't have pain, and your body's going to adapt. It's going to get stronger. And we don't have to, pick straws at that type of stuff. Because you're right. People listen. People hold on to words and stuff like that. So, all right. There's a couple things that I just want to talk about and get your take on it. And so, if you don't mind, Christian, I'm going to present an idea from the video and give my opinion. And then if you want to give your opinion, and then we can go on from there. This is the part of the video that I don't want to sound like a dick, but there are things that were said that I'm like, I don't know if I wholeheartedly believe in that. So anyway, I did take a timestamp on this. Around minute 9, he's discussing the McGill Big Three. And when he gets to the bird dogs, he discusses how the bird dogs offset different parts of the spine, which activates smaller muscles along that spine. I'm just going to say paraspinals. I'm not going to get specific on different muscle groups, but basically saying that these small muscles in the spine going from vertebrae to vertebrae helps get activated, which enhances body awareness, which can make you move better, mitigate pain, etc. I would agree that doing something like a bird dog can make someone's pain better. Now, to take it those steps 3, 4, and 5, I don't necessarily believe that just because we do a bird dog, that makes people more aware of vertebral movement from segment to segment, and that that's the reason why the back pain goes away. I feel like that's a pretty bold claim. Christian, your thought?
Oh, I agree. This isn't some Sherlock Holmes shit where you gotta do all this crazy reasoning with all these different steps. It's just, did it work? Didn't it? Like, I don't know how else you need to think about this. It's not, whatever he's saying isn't happening, for one, or anything you do is gonna make those muscles kick on. It's not that you can selectively contract those muscles. Even the groups of people, and I'm gonna get shit from pelvic health therapists for this. They help people a lot. I'm not saying I'm an expert here. I don't know all of what they do.
Never do what they do.
Right. But when you do the classic, you're lying on your back, you put your hands on your lower belly, and you try to make your transversus abdominis contract. Yes, you're going to make that muscle contract. You're also making a lot of other muscles around there contract because you can't selectively contract them. It's not like it's your bicep. Even then, you're still getting some other stuff kicking in. But you can't selectively contract these individual spinalis muscles that connect your T12 to your L1. It's not a thing. So it's just it's all fancy phrasing to make things sound really cool. And if that gets people to buy in and they want to do the exercises, great. But when you don't get better from doing the McGill Big Three or doing the bird dog, please don't blame yourself for your spinalis muscle at T12 and L1 not firing properly.
All right. I agree with that. A little bit later, he goes on to discuss the slump test and how to perform it. Slump test, I don't think, is inherently bad. He goes on to say, do the slump test, describes how to do it. If you get this nervy sciatic type pain going down the back, then I think he shows a really great graphic on how a herniated disc and how goes into the whole, jelly and a donut theory, which I recently listened to a video on, is it Adam Meekins? He's a physio out of the UK, and he basically was like, why are we still talking that the disc is like a jelly donut when it's much more clearly like a forget the exact thing he talked about, but it's a much more sturdy structure than just a jelly just squeezing out. Anyways, so assuming you have a positive slump test, that goes on to say, whoop, let's do nerve glides then, because you have sciatica, or in other words, you have neuropathic pain versus just nociceptive pain. I wouldn't necessarily make the jump that one single test done like a slump test is going to automatically cue off in my head to say, yup, absolutely, you got neuropathic pain. Let's do some nerve glides for that. I also feel like I've had minimal people actually present with just a very positive slump test, and it's like, shit, like that's what that's supposed to look like. Yeah, that's a positive slump test. 9 times out of 10, people with low back pain and leg pain, I do the slump test, and it's like, just feels like my hamstrings are tight. Anyways, so I'm not a giant believer on the whole, like, do the slump test, that's positive, do nerve glides because you have neuropathic or sciatic type pain. Christian, your thoughts?
Yeah, I think either way is, if people have numbness, tingling, burning, or shooting pain down the back of their leg, which you would typically call sciatic, and you have a positive slump test, if you feel better by doing some nerve glide techniques or nerve flossing, whichever way you want to call it, then great. There's good research on those techniques to calm down irritable nerves. However, it also can do the exact opposite. So it's one of those things you just have to test because it doesn't work for everyone. And so I certainly think you should try it. And then, yeah, when people have a positive slump test, it could be their natural nerve tension. If I do that test right now, I will have tingling in my toe. Someone might say, I have neuropathic pain, or I have excessive dural tension, which is nerve tension, and I therefore have a problem and I need to fix it. It's like, no, you're just stretching the shit out of my nerve, and it's going to start tingling. That's just the way that works. And so, really, I think that was one of his points I was okay with. Just don't think that you need to do those types of glides to get better, because it may not work.
Yes, and I do want to add on as well, for chronic low back pain in the CPG, it does give nerve glides a B-level evidence, and so relatively pretty good cause to do some type of nerve glide if you do have these sciatic type symptoms. So yeah. Anyways, he discusses 2 different tests at the hip that he would do, or that he does, to show what hip deficits might be causing your low back pain. One of them is just a simple internal rotation and saying that, if one side is less than the other side, that's a positive sign that your hips are tight, and that could be the cause for your low back pain. Another one he goes into is the Faber test, which is interesting because he mentions that in the Faber test, if your leg doesn't extend as far as the other one, and then that hip is limited in that motion, and you should work on it. If I'm not mistaken, Faber stands for flexion, abduction, and external rotation. I don't know where he gets the extension from. I think he's talking about when you drop that knee down, that's externally rotating, and that's what the test is showing there. If I remember correctly, the Faber test, it can be used to show a combination of movements in the hip for mobility purposes, but I've always thought of that test to be more of a, like, thinking about trying to provoke your symptoms at a certain spot. If you're getting growing pain, glute pain, SI pain, etc., and then there's a possibility that maybe your pain and discomfort is coming from intra-articular structures or gluteal pathologies, or maybe more in the sacral region versus range of motion. I never really thought of it that way, but yeah, anyways, using the Faber test to identify hip mobility deficits and using that to then improve your low back pain. Christian, your thoughts?
This goes off of our last podcast about regional interdependence, where I think one of the arguments that he's making is that if you are tight in your hips, or let's say you have low back and you assess your hips and your hips are really tight in these key directions, that it could be that your low back is having to move more than it likes to make up for the lack of range of motion in your hip. Certainly, that could be possible. And I'm not against you stretching your hips and doing exercises for your hips, because, spoiler, that's part of a comprehensive plan and generally works pretty well for people with low back pain. So definitely work on those things. But I've also had loads of people that have horrible hip osteoarthritis, and they definitely have positive tests there. They don't have low back pain. People that have low back pain and their hips move fantastic. Their hips are definitely not limiting their low back range of motion. And this goes off of something that I had a bit of a back and forth with a doctor a couple years ago about, where she referred a kid to me for hamstring stretching because the kid has low back pain. And she said the kid has low back pain because his hamstrings are tight. And when he bends forward, he can't bend forward enough at the hips, so he bends more at his low back, and that's causing his problem. I'm like, okay, like I know what you're saying. I've heard this all before. We're just gonna figure this out. And so I meet the kid. I do hamstring length tests. So like he's lying on his back. I lift his leg straight up towards the ceiling. He gets all the way there, even farther. If I were to have him sit on his butt with his legs out straight, he would damn near get his face to the floor. And so his hamstrings weren't the reason for his low back pain.
Yeah.
It's just a thing that you think is happening and you think is important. It might be for some people, but it doesn't mean it's for everyone. And you can't just say these blanket statements and expect them to be true with everyone. You have to actually do the test. And then even if you do the test and it comes out positive, you're like, yeah, it could be. It might not be. Just do it anyways if you want. But don't hang your hat and say, oh, there's a positive Faber test. This person has limited hip range of motion. This is the reason they have low back pain. I'm going to do all these different hip stretches and band traction things, whatever the hell it is, and they're going to get better. Probably not. And I say probably not because the research wouldn't agree with you. And trust me, I've done it. I did it when I was far less knowledgeable, and it didn't work. And so, like, I've done all these things.
Yeah. And the other thing I would say is, like, you know what? Doing hip mobility, regardless of what the heck the Faber test says anyways, or internal rotation test, or the Fadir test, or whatever frickin' hip test you want to do to test for mobility, if you just program in some hip mobility stuff regardless, you're not going to hurt anything, and you're probably going to make something better along the way. It might not resolve the back pain completely. So yes, I would agree though. I think we're doing the body a little bit of disjustice to say that you have a positive Faber, therefore your hip mobility on the right is less than the left. Therefore, that's causing your low back pain. Therefore, if you do these things, it's going to get better. That's a very reductionist type viewpoint, which I don't think is bad, but I think it just does the body a disservice. The body is very complex. We don't know everything about it, especially when it comes to pain and movement. We don't know everything about it. We try our best to try and figure it out for you and make you better along the way. But even in that podcast with E3 and Greg Lehman I was listening to, Greg Lehman even said sometimes that, yeah, people get better. I'm like, I don't know how the hell you just got better, but hey, you got better. You know, is it because you got stronger? You got better. And that's the same thing with when I practice too. I'm sure, Christian, with you as well. Like, we prescribe stuff, we do stuff, and the patient gets better. And it's like, well, I think this is what it got better. But then in the back of our heads, at least I do, I'm like, hey, I couldn't tell you 100% why this worked, but it worked. So I agree, though, hanging your hat on one test or hanging your hat on one thing and saying, yeah, figured out the body, cracked the code today, Faber test, that's why. I don't know, I don't wholeheartedly believe with that one.
Yeah, you can't be a reasonable human being and think that that's the way things work. You either are ignoring a lot of failures that you've had and you just like the smell of your own fart, or you just haven't seen enough people. Like, I don't know what else to say. Like, you haven't failed enough.
Yeah.
There's no other way for me to think about this. Like, I've just done it so many times. I know that it doesn't work. I'm telling you. It's crazy to think otherwise. And yeah, I know that we've been very passionate and heated with this conversation. And I'm just not trying to be mean to squat you or anyone that does these things. It's more just I have a lot of frustration around these things because I see people every single day that carry the burden of these words and these teachings, and they negatively affect their lives. And I'm just tired of it. And I want us to be a voice for change there and helping people realize that the information in this video is a very, very small piece of the puzzle. And it needs to be a part of a comprehensive plan and should not be taken as scripture or gospel.
Absolutely. You alluded to this before, throwing a band around the hip and then doing some internal rotation mobilizations to the hip. I think I went on a rant last podcast on this one. So I'm going to try not to do it again. But you look at a cadaver of someone's hip with capsule intact, labrum intact, etc., and you're going to tell me that throwing a thick band around the hip and then lunging in a certain position that A, we're assuming that the line of pull is just perfect on the hip to do this mobilization. B, we're assuming that a band is going to have any effect on how that ball and socket joint moves with the suctioning effect of the labrum and the stability of the capsule. Yeah, I think more likely we're probably just applying a stress superficially. We're putting a mechanical pressure into that area, and it's causing just some local, I don't know if you want to call it analgesic effect, but like just like some local like calming of that area. I don't think we're doing blank to the mobility of that hip when you do that, to be quite frank with you. I'll die on that hill. I'm kind of tired of these frickin' banded mobilization things, self techniques. Again, I don't think it's doing what we think it's doing. But anyways, so do it. If it makes you feel better, do it. It's not going to hurt anything. But again, to hang your hat and say, yep, just mobilize the hip with a band, figure that one out again, it's like, no, I'm not going to stand here and be like, yeah, we're able to mobilize that frickin' hip with a band and someone who doesn't have any medical training. I'm not trying to diminish the knowledge of patients and clients, but to just assume that you lined up that line of pull just perfectly on that joint, no, I'll leave it at that. I just don't believe that's doing what it's doing, but if it makes you feel better, then do it.
Yeah, and I personally use those. I used those band dislocations, not just for patients, but for myself. Because when I first started practicing was when Kelly Starrett was really popular, and Gray Cook and the functional movement system stuff was all popular. Stuart McGill, all these things. It was like, that's where I came into physical therapy. That was my first experience in the world. And so I did all this stuff, and yeah, they worked a little bit, the band distraction techniques, but they only got me so far. At the end of the day, I learned this for myself. If I spent 10 minutes doing banded work like that, I got X amount better. If I spent that same 10 minutes just sitting in the bottom of a squat and suffering, I got Y amount better. You know which one had a greater effect? Was sitting in the damn squat. Just sitting there and suffering day in, day out worked far better than the banded stuff. And yeah, I guess you could combine them and see which one works better. Proportion of each one and other things you like to do work the best for you. But generally, just getting in the position that you suck at and suffering and working on that very regularly, that's how you do it. That's just the best way in my lived experience.
Yeah, exactly. And that's because our tissues are living. That's because they adapt. That's really, I think for me, that's where the magic of PT, that's where like really good physical therapists, like that's how they strive, is because they're able to find that point for each individual, which is so individualized based on many different factors, but they're able to find that point for each individual and work with them in a way that, you know, they're giving enough to adapt, but they're not doing too much. Like you said, if you did nerve glides until your frickin' head turned blue, you might piss off the nerve because you do it too much, because you're overdosing it. I tell my students, and sometimes I'll tell my patients too, like, I don't think there's a bad exercise. I think there's just poor prescription. Bird dogs are fantastic. If you underdo it or overdo it, they're going to turn into not very fun exercises, and people are going to think that, well, bird dogs are just complete shit. No, you just didn't prescribe it correctly. And even, I don't know if prescription is the right word, but now we're getting into the whole idea of strength and conditioning and this idea that, like, yeah, do we even, no, we're not going to go down.
Stay on top.
Anyways, so yeah, I think that, like you said, banded mobilizations, if they make you feel better, if it gets you in the right psychological mindset, if you feel like you're ready to perform better after, or the pain gets less with it, absolutely do it. That's my stance on that. And lastly, my last point that I want to bring up, he mentions low back pain causes your glutes not to fire, or glute activation.
He said that? I missed that. Okay.
Yeah, that was like at the very end. Gotta watch all the way through, man. You would have. So here's my take on it, and I'll open the floor for questions and discussion. I don't think our glutes forget how to work because we have low back pain. I don't think our glutes ever go to sleep either. I think our neural connections stay the way they are, and I think that the glutes do what they always do. And to say that the glutes are now not activating, or they're not firing, or we're getting glute amnesia because of low back pain, I'm going to call major BS on that. Christian, your thoughts?
If your glutes weren't fired, this is a Lord of the Rings, you would be crawling on all fours like a beast. There's no way you'd be able to stand up. I don't know if this is a thing in the glutes in low back pain like it is in the knee with the quad, but in the knee, if you have pain in your knee or swelling in your knee, trauma from surgery, whatever, it makes the quad not work as well. Your body shuts it down a little in an effort to force you to put less stress on the recovering tissue. Maybe that's a thing that happens in the butt. when your low back is sore. I don't know. I don't know if you know that area,
Yeah,
but
I
perhaps,
haven't read a paper on it.
yeah. Does strengthening your butt make your back pain feel better? Yeah, absolutely.
Probably.
Look, it's really
Yeah.
difficult to strengthen your butt without getting your low back going too. Like they're contiguous structures. They feed into each other.
Yeah.
But anyways, just train the damn hips. Your back's gonna feel better, and train your back. Your
Yeah.
back will feel better.
Exactly. Maybe the reason why training your glutes helps with low back pain isn't because your glutes forgot how to fire and now you're waking them up from a deep slumber. Maybe it's because we're getting just the right amount of low back pain loading, or not low back pain loading. Let's just say lumbar loading when you're doing glute exercises, that it's not too much so that the body is able to adapt without getting oversensitized and flared up. And when you do that over time, the back feels better. Maybe it's not because the glutes are getting stronger, which if I had to put money on it, glutes get stronger. That's probably going to help a whole lot of stuff, including low back pain. For the purpose of it, I agree. I think when you do glute work, you're also getting inherently just some low back loading, activation, whatever the heck you want to call it, going on as well. And maybe that minimal amount, because it's most focused on the hips, so the minimal amount of loading and activation in the low back, that's what's causing the low back to get better, is just because you're loading it at a more appropriate rate versus not loading it at all or loading it too much. So yeah, anyways, my take on that one as well. I would agree with what you're saying there, Christian. Any other points to bring up, things about the video? I know we've already, somehow the first
This will
one
be a
got cut
two-part.
off, and yeah, and now we're already 15 minutes into this. I think we're well over an hour. Anything else about the video? I have a closing remark, but anything else about the YouTube video or things you want to say before we wrap it up?
Yeah, I'll just close with so you mentioned Peter O'Sullivan earlier in this podcast. For those that don't know, Peter O'Sullivan is a world-renowned low back pain researcher and practicing clinician, physical therapist. He literally wrote the book on how we learn how to treat low back pain in physical therapy school. I had to read that many years ago. And he used to be a huge proponent of everything that Squat University is saying in this video, because that was the best stuff that we knew at the time. That was best practice. However, Peter O'Sullivan has since changed his stance and no longer promotes this kind of thinking in a vacuum as like the end-all be-all. And he's now working on a completely updated model of how we treat chronic low back pain called cognitive functional therapy. And it really is showing great promise. And the whole premise of cognitive functional therapy is you're combining multiple highly beneficial ideas in the world of low back pain into one comprehensive treatment plan to help newer clinicians and older ones have a really good starting point. So on this podcast that I was listening to, Peter O'Sullivan said when his patients talk to him about neutral spine and bracing and how they need to move to not be in pain, he asked them a simple question. What did you do before you had low back pain? The answer is that literally no one thought about their back. Therefore, in my opinion, it's reasonable to assume that we can get you back to that, moving without thinking about it. That is the entire goal.
I think that's very well put, and I'm glad that you brought that in there and gave that background on Peter O'Sullivan, so that people know kind of where he came from and what started transitioning him to the path he's down now. I would 100% agree, promote that idea of, I don't think about my back every day. You probably don't think about your back every day. But when we get this type of low back pain, we can get very honed in on that. And it's this idea of trying to get away from that. And so, no, I think those are great ending remarks there. What I'm going to say is just, if you have low back pain, one, it's very individualized. Many different things are going to work. I don't think you need a specific 7-step process. I think that in general, if you do a lot of different stuff from the video, it's probably going to help somewhat, if not help the whole thing. But to promote that this is the way and that these are the things from Stuart McGill and, more of a pathokinematic viewpoint, pathoanatomical viewpoint of it all, I think that stuff can just become very fearful to patients, and they just get fearful of moving and fearful in thinking that there's a very rigid way to do things. And I just don't think all that stuff is true. Some people benefit from it from time to time. Hell yeah. Do we do it from time to time? Hell yeah. But that's because it's very individualized. And so for me, when it comes to low back pain, calm shit down, build it back up, and then keep trying to improve your capacity to tolerate load and work throughout the day with just being generally fit and active. That's going to really, from what I can see and from what I read, do the trick. It doesn't have to be over complicated, doesn't have to be Sherlock Holmesy with figuring out what's going on. It's just, calm things down, build things back up, and don't forget that we're treating a human being. We're not treating discs, and we're not treating muscles and vertebrae. We're treating a human. So yeah. Anyways, well, that was a good one, Christian. Thanks.